So this is CPSGT exam blueprint. Blueprint means this is something like to the board exam for your licensure, what kind of questions, what kind of content is going to come. This is the thing that's going to explain you. Now, so let's see. It has three modules, like three domain it is called. CPSGT exam blueprint. A new form of CPSGT exam went into effect. That means from May 1st, 2018, they have started this module. They have started this curriculum. And all the candidates sitting for the CPSGT on or after May 1st should review the exam blueprint found below. Okay, this blueprint is for after May 1st. So normally what happens is, here you can see there's a 75 multiple choice questions will be asked, and 60 items count toward your candidate's score. That means 60 questions will count your total mark, and 15 are pre-test, that's called pre-test items. 15,
Pretest.
that means when you give your test, 15 questions are kept over there just to see like your how you do in your exam. These are not going to affect your mark. Like let's say you did all of your 75 questions and you did mistake on 15 questions, and 15 questions were pre-test items, then they are not going to affect your test. You are still going to get 100%. Out of 75 questions, 15 questions are just kept over there to see like how you do, but that's not going to affect your score. Now the first domain is the general knowledge. So what you're going to study in this course, first is medical terminology. The medical terminology is like sleep study, polysomnography, those kind of thing, like because this is going to deal with the sleep study. So there's like MSLT, wake, sleep, REM, stage 1, stage 2, like EKG, heart pattern. There's several medical terminologies you're going to study. Then second thing is safety. The safety situations, like how you're going to make your patient feel comfortable, how to be compliant with the rules and regulation of the healthcare. And the next thing is verbal and written communication skills. You have to be very formal with the verbal while you're having conversation with your patient, and also written communication also. But this is, when it says that, you may be feeling like, oh my goodness, there's too much. But anyway, there's not going to too much. Once you start studying, it's going to be easy. And ethics, you have to be very careful. You have to respect all the patient, all your like co-workers, your managers, and everyone. So you have to keep your ethics very strong.
Serious.
And patient confidentiality. This
Yes.
confident, everything in the healthcare administration, a healthcare business is very confident. You're not going to share with anyone, even their patient name. So you have to make it very confident about, you have to be very confident about those. So basic patient care, like you have to be very careful about the patient, take care of them. So those kind of things you have to know. And emergency procedures. Sometimes the
Procedure.
patient may have VTAC, heart attacks, seizures, so different situations, and that's called the emergency protocols that you have to follow. So you have to know about those things. You also have to know the math skill, basic math skill. You don't have to do the complicated like differential, partial differentiation, or integration, or those kind of thing, but very, very basic, like plus, minus, multiply, division, those kind of thing. And basic calculation you have to know, and basic knowledge of like computer. And you don't have to know like a vast computer knowledge, but at least you have to know like word, Word, and like Excel, Word, and PowerPoint, and those kind of things. Very basic thing, and we'll learn more all of those. A successful candidate will have basic knowledge of sleep apnea, diagnostic criteria. You have to know what is sleep apnea, what is diagnostic criteria, practice parameters for sleep apnea. What is this practice parameters? That means the sleep apnea, how you say what types of sleep apnea is this. So you need to know like those kind of things. Adult and pediatric testing procedures. You need to know more about adult sleep study, and you also have to know like some knowledge of pediatric testing procedures for sleep apnea. And scoring rules, like after you do the sleep study, you have to score. Scoring means you have to know the pattern, sleep pattern, stage 1, stage 2, 3, 4, like those kind of sleep pattern. And so you have to know that to score the sleep study. And EEG wave morphology. Morphology means how the sleep waves travel, how to name them, how to identify them, like what kind of sleep like patterns are. Sleep physiology, that means sleep physiology means like the different ways that people sleep, and how what is sleep and normal sleep, and abnormal sleep, sleep problems. Those are things are sleep physiology. You have to know. Respiratory physiology means how people are do respiration, the respiratory rate, what is normal respiration, what is abnormal. We will learn about that too. And cardiac physiology, like cardiac, like heart normal heart rhythm, abnormal heart rhythm, different types of heart rhythm that we'll understand. We have to study those. And also we have to study about troubleshooting skills. When you're doing sleep study at night, at that time there's a different kind of technical problems, that there's a physiological problems, or the environmental problems, security problems. So you will learn about those things. Intervention and the treatment, CPAP therapy, that means intervention, like what kind of mask you're using, and how people, patient are comfortable or not. How can you make your patient comfortable, and what kind of therapy you're going to use, CPAP, BiPAP. There's different types of therapy that we are going to study about that too. So recognition of need for bilevel therapy and supplement oxygen. There's a different, there's a CPAP, and then goes BiPAP. BiPAP is a little bit high level, I can say, like a little bit complicated therapy. So if the patient needs that or not, we will understand that also. And some people may have like oxygen problem, and we will understand and how to administer oxygen. Now we are checking over here like a blueprint, like what are they going to ask in the test. The first one, you have to understand, that's the domain 1. There's a 3 domain, and the domain 1 is sleep study preparation and performance. That means when you in the sleep lab, when your patient is over there, how you prepare your patient. That I already told you. We saw the video before where the little kid was over there with her mom. Then the technician was talking to her, introducing herself and talking to her, making her comfortable. And so in this, like first things for domain 1 that we do, the prepare our patient for the sleep, and how you do the performance. Okay, the task A, there's a 3 ABC. Task A, the first one is task is review patient information and perform clinical assessment. That means all the patients who come over there, the doctor has ordered the sleep study. So what you need to do, you have to review the patient information, like verify clinician's order, doctor's order, and testing indications, like what kind of study we have to do. And the doctor may tell you like, okay, you do this study this way. So a spatial comment or the doctor's comment we have to understand. And then we will study about patient history and physiology, physical, and medication, what kind of medication patients are taking. And patient interview and orientation, like you have to talk to the patient and you have to do the orientation, talk to them, and make sure that understand you. After that, we do the questionnaire. Okay, do you understand what this means? Like what I'm saying, like you have to prepare your patient. Like before, when the patient comes to the sleep lab, you have to introduce and yourself, and then you have to, after, before patient comes in, actually you have to verify doctor's order and what kind of test, and check about patient history and physical. Like history means what kind of problems patient has, why patient came to the sleep lab, and what is height, weight, and other kind of physicals. You have to check what kind of medications patient are taking, what kind of situation or problems, sicknesses patient have. Those kind of things you have to know. And then once the patient comes in, you talk to the patient, orient them about the sleep lab and the procedure, and give them some questionnaire that the sleep lab has some questionnaire for the patient. That's the domain one. Like we are still in domain one, task B. And the domain one, sleep study preparation and performance, in the test, in your licensure test, 45% questions come from there. The first one was preparation. The second one is also technical preparation for procedure. Task B is the technical preparation for the procedure. This is not for the patient, this is for you. You have to know about your equipment, you have to know about your supplies, you have to know about the montages, and the montages means you will study later. I know you don't know about right now, but you will understand about this. And you have to identify anatomically appropriate locations, like where the patient, where you're going to do the hookup patient, where the patient is going to sleep, the bathroom, and the waiting room. Those kind of things you have to understand. And site preparation and application. That means you have to prepare your site, your locations, your sleep. Like you have to hook up like you have to prepare your, the card where you're going to put like different thing over there. So you have to prepare your card and everything that before patient comes in. And after that, once you start your hookup, you have to check your impedance verification and calibration, that to make sure that your machine is working good. Now from this task B, like this is the domain one, sleep study preparation and performance. 45% questions will come. Out of that 45%, from task B, 22 to 26% of the questionnaire will come. Now next one is like domain one, same thing. Out of this 45%, task C, that follow procedures and protocols. There's a different kind of protocols: the adult protocols, pediatric protocols, daytime testing protocols, MSLT, MWT, home sleep study testing protocols. So there are like 4 different types of protocols you have to follow. And yeah, the adult protocols like PSG protocols, how you're going to do the hookup, how you're going to run the sleep study, what kind of montages you have to select, those kind of things. Normally, about this protocol, 30 to 33% will come from this one. Okay, so I mean, I know like this is getting so new to you, and you may be not understanding anything about it, but I'm telling you, don't worry about it. Once we start studying, then we will start, like I'll tell you, like this is the adult protocol, PSG protocol. Then I'll tell you how to measure what is 1020 system, and I'll show you how to do those. That's why that's called protocol, so not to worry about that. Now this is domain 1, and still there's domain 1, task D, and out of 45% of the question, the task D is like identify, respond to, and document findings. That means you are running the sleep study now. The pattern will look like this. You see on the picture, it is like the pattern will look like this: the EEG waves, respiratory waves, EKG waves. So this kind of oxygen and position. So these are the, okay, this is called EEG, and this is called EMG, and this is called This is respiratory. Like when patient are breathing, you see like these are zigzags are going on like. So this is how patient breathe. This looks like normal breathing. Now, and this one is EKG. This is EKG. So EKG is like heart rhythm, and this one is like oxygen drop. So oxygen you can see here 96, 97, and the next one S is, this is yes means like positions, supine position. So this is all about graphical pattern notification, graphics, and there's nothing like word or picture. This is all the graphics, the waves, and from the waves you have to understand like what kind of sleep study is this, what kind of stages and everything. So here number one is said like waveform. This is the wave that we're talking about. Abnormal, EEG, EKG. See, like EEG means the first one. This one is EEG. EKG, this is EKG. EKG means like heart rhythms, electrocardiogram. Like this is the EKG. And this is respiratory. So the artifact. And sometimes like this is normal, but here you see like here it has, you see like this line, these lines are matching or coinciding with this heart rhythm. Actually this line is supposed to be just like this without this line. So this is artifact. What artifact means? All those waves that you see in the waveform which are not needed, unessentials. They somehow just came up because of the hookup, because of the patient. Those are not needed. Anything not needed, they are called artifact. So equipment malfunctions means that if the equipment is not working at the time, you have to know general how to fix those equipment. Physiologic and the clinical events, like you need to know about physiological and clinical events. You have to understand about your patient, about their situation, about their history, those kind of things. Setting filters, sensitivity. To make this wave better, you have to know like how to fix the so different settings you have to know. Those are called filters, sensitivity, gain, and you will understand, you will study about that too. So the 26 to 30% of the question will come from this part. Okay, now we will go for domain 2. Now no, domain 2, and remember the first one was 45%. From domain 2, 30% of the question will come, and this domain 2 deals with physiology, recognition, and summary. Physiology, recognition, as summary. That means task A, recognizing physiologic event in adult and pediatric. What is physiologic event? That means you need to know like what type of stages, what is stages of sleep. Is stage 1, 2, 3, REM sleep, wake sleep. You need to understand, like looking at this wave, you need to know like patient is in sleep, patient is awake. So those kind of things. Arousal means like when patient gets up, wakes up from sleep. How do you know like patient awake or patient is just has arousal? And how do you know that different types of respiratory event? Patient is holding breath, patient is breathing, patient is not breathing, those kind of things. Desaturation, like oxygen. Here you see all the oxygen level is 97. So this patient is not desaturating. Desaturating means when the oxygen level drops down because of some reason, that is called desaturation. And movements, and these waves also tells us like movement. When patients are moving, when they are awake, they are moving, then we can tell from looking at the wave, we can tell them like patient is moving. The next thing is cardiac event. You see the cardiac, this is the heart rate, heart rhythm, and this looks like normal, but there's sometimes the abnormal also. So those kind of recognizing this kind of thing, like this pattern, this is called like pattern or physiology recognition. And so this, from this physiology recognition, 30% of the question will come. Or out of this 30%, you say 67 to 78% of the question will come from this. And I'm pretty sure and 100% confident you can do it very easy. And because this is like a technical thing, once you practice, you can do it very easy. It's not logical. This is technical. And once you know how to recognize the waves and all this thing, then you can do it. It will be easier. But it's a good thing, 67 to 80% of the question will come from this domain 2, physiological recognition and summary. Now, in domain 2, sleep physiology recognition and summary, task B is perform calculations and documentations observation. 22 to 33% of the questionnaire will come from here. And this is like formulas, different formulas, very simple formulas, like AHI. What is AHI? What is sleep latency? What is TST? Total sleep time. AHI means apnea, hypopnea index. Sleep latency means from wake to first stage of sleep. What is the time frame? Like, it is very simple thing. Once we start sleep study, training, then you will know very easily what are this. And the technician summary, that means what you're supposed to write down over there. Technician summary, like what you have to explain, what you have to indicate on the sleep study that night, followed by the night, what kind of information you have to give to your doctor. So there's some certain kind of like template that you have to understand. You maybe have to recite those, or so you can do it easy. No worries. That kind of like from this part, 22% to 33% question will come from this domain 2, task B. Now comes domain 3. Domain 3 is therapeutic treatment and intervention, which is 25%. Like, this is domain 3. First one was 45%, second one was like 30%, and this 35% of the question will come from this one. So the task 8, like therapeutic means like treatment. You see here in the picture, she's using the CPAP machine, CPAP mask. This is called therapeutic. Therapeutic means the treatment, what kind of treatment you're giving, how to administer CPAP. Like task A, it says administer CPAP and bilevel therapy. Therapy, and this therapeutic word came from therapy. So therapeutic treatment and intervention. What kind of mask you're using, what kind of treatment a patient needs, you need to know that. And so titration guidelines, there's a certain way that you can do the treatment, and that guidelines, that procedure you have to know. And acclimation and proper interface fit, that means acclimation means like if the patient is comfortable with the mask, whether patient likes it or not, you have to understand if the patient liked it or not. You have to understand how to make patient feel comfortable. Acclimated means like patient is supporting or satisfied with the mask fitting and the therapy. That's called acclimation. And the proper interface means mask fit. Interface means mask, okay? So this is interface that you have to know, like how to fit mask. Troubleshooting and intolerance. Troubleshooting, just like interface, the mask may be not good, the CPAP pressor may be not good, the humidification is not good or something. You can adjust all of these three things to make patient, feel better. Troubleshooting means that one. So you're trying to troubleshoot so that your patient feels good. And explain importance of therapy, that you need to explain patient what is this therapy or this mask is going to do for them, how this thing helps them. So this is really important that you need to tell the patient. And believe me, it seems like very complicated, but we'll make it very easy. And 80 to 93% of the questionnaire will come from this. Out of 25% from domain 3, 80 to 93, there's a big number of percentage of this domain 3 is going to come from this. And now domain 3, there's another task B. This is the oxygen therapy. From 7 to 20% of the question will come from this. Oxygen therapy, there may be one page. This just the one very simple page that tells you how to administer oxygen to the patient, how much oxygen we have to give to the patient. We have to have like certain kind of knowledge about it, but most of the time every sleep lab have their own protocol, oxygen protocol. Every sleep lab has it. So we need to understand the protocol, what it says, like how much oxygen we have to give them. Normally whenever the patient we start from 0.5 liters of oxygen, then we go 1, we can go 1 from 1 to 2, 2 to 3, 3 to 4, and most of the time we don't go over 4, but it depends like what your lab protocol, sleep lab protocols tells you. It is one page. It's very simple. So out of 25%, 7 to 20% of this questionnaire will come from for domain 3. Okay, so this is how the blueprint of this CPSGT is constructed, or as so this is very simple. So understand, like there's a 3 different domain, and out of this 3 different domain, it prepares of us like how to prepare the patient, how to do the sleep study, and how to do the treatment level, and what is the oxygen protocols, therapeutic, physiological thing, those kind of thing comes.